Thank you, Christine. Good afternoon, everyone. Before I turn it over to Dr. Strang, I want to express my condolences to the families of the loved ones of the two individuals who were lost at Northwood this weekend. It is difficult enough to lose a loved one, but losing it to COVID in a time where we can't mourn the way we're used to mourning, where we come around and we hug each other and we're able to be there as our loved one passes away. I want you to know how difficult this has been on our province, to know that you are going through this. And I want you to know that you are in my thoughts and the thoughts of all Nova Scotians. I also want to thank Nova Scotians for continuing to follow the advice of Dr. Strang in public health. As our testing continues, we are flattening the curve when it comes to COVID and seeing the number of positives go down. We need to continue to work to make sure that we flatten this curve so that we can move back to a life, somewhat of a normal life. So I ask you to continue to do the great work that you've been doing over the last number of weeks. Dr. Strang.
Thank you, Premier. Good afternoon, everybody. And I echo Premier McNeil's remarks. My thoughts are also with everyone grieving the loss of the individuals who passed away in the last couple of days at Northwood. We now have 48 Nova Scotians who have died due to COVID-19, and that continues to be a reminder of how serious this disease can be and why we all need to work together to protect those most vulnerable in our communities. Today I am reporting one new case of COVID-19, which brings the total number of cases, confirmed cases in Nova Scotia to 1,020. We have had a few good days in the past week with low numbers, and that is good news. But I want to caution everyone against reading too much into any single day or any few days. We are in a long-term situation, and we need to have sustained changes before we can make definitive conclusions. Yesterday, the QE2 lab processed 427 tests. Today, we have 9 individuals in hospital, 4 of those in the ICU. We have 864 Nova Scotians who can be considered recovered from COVID-19. We have 34,204 people now have been tested and had negative results. We have 3 licensed long-term care homes and unlicensed seniors facilities with active cases of COVID-19. Northwood in Halifax campus has 157 residents and 8 staff with active cases. One other facility has a single staff member with an active case, and a third facility has 1 resident with an active case. Again, while it's good news that our new case count is trending in the direction we want to, we can't make definitive conclusions yet, and we all must remain vigilant. It's important that we continue to have Nova Scotians who have symptoms that could be COVID-19 come forward and be tested very early on so we can do appropriate public health follow-up as necessary. So anyone who has 2 or more of fever, new or worsening cough, sore throat, runny nose, or headache, we ask people to contact 811. If you're able to, do the online assessment. If you don't have online access, then calling 811 directly, and you'll get further assessment and direction from 811. I know we've had questions about today's numbers and the difference between active cases provincially and the active cases in long-term care. Specifically, people questioning why the provincial number is lower when in fact it should be higher. I want to just explain that for people. In the last 24 hours, public health has worked very hard to resolve a large number of cases and move them from the active category to the recovered category. Unfortunately, we're in the situation where our long-term care data comes from a different data source than the Public Health Panorama program and is on a different timeline. So that same work has not yet been able to be done specifically with that long-term care data source. We are working hard between long-term care and public health to make sure that 2 data systems become more consistent and resolve this issue. And so that work is underway right now. So that is the explanation. But if people are looking for the source of truth, the true number and the number of active cases is the provincial number, not the long-term care number, which lags behind for the reasons that I specified. As Premier McNeil said, this week is National Nursing Week, and I do want to take a moment to acknowledge and thank all the nurses in our province for everything they do. Nurses work in many environments, in hospitals, schools, long-term care, and public health, at post-secondary institutions and other places, often with our most vulnerable, and their contributions to the healthcare system cannot be overstated. So from me and from the Premier, thank you to each and every nurse in Nova Scotia for the work that you do every day, looking after all Nova Scotians and our healthcare needs. I now want to turn to some of the follow-up on some of the communication around schools. That I know parents and students have many questions about accessing their belongings that were left behind when schools were closed. And then now that we've announced that the school year will end on June the 5th, but it will be virtual learning up until then. Beginning the week of May 25th, a single student or family member will be able to access their local school by appointment. Staff in my office are giving public health advice to the Department of Education and Early Childhood Development around this process to ensure that it can be done safely. Access to schools will be by appointment to ensure that we can respect the public health principles of social distancing and limited numbers. The school system, schools, the education centers, regional centers for education will be in touch with students and families in the near future for more details around how to make appointments. We wanted to make sure families were aware that the steps will be put in place where you can retrieve or students can go and retrieve their own materials from the schools. I want to end by talking about growing information around the link between smoking, vaping, and COVID-19. Yesterday, the World Health Organization issued a statement about smoking and COVID-19, and it's important that we understand that this evolving evidence. Certainly, we know COVID-19 is an infection of the lungs. It's a respiratory disease. Smoking and vaping are well-known risk factors for a broad range of respiratory conditions and illnesses. We now have evidence, studies that have been brought together and examined by the World Health Organization now find that smokers are more likely to develop severe COVID-19 disease when compared to non-smokers. That's because of the direct links with smoking, the harms on the respiratory system, but smoking also has negative impacts on our immune systems, increases the risk of other diseases which create vulnerabilities for COVID-19, such as diabetes, heart disease, and cancer. So all of those diseases put people at increased risk for developing severe COVID-19 disease. Quite simply, smoking and vaping may not only, in addition, put you at greater risk, they may worsening the symptoms if you do contract COVID-19. They certainly will impede somebody's ability to recover successfully or fully. Since COVID-19, and we know is going to be with us for a while, my message today is that if you smoke or vape, it could be it certainly will be impacting your health and also putting you at increased risk for severe illness and poor outcomes if you do get COVID-19. So I want to make sure people are aware that if they smoke or vape, that there are resources to help them with this. You can talk with your doctor, pharmacist, or other healthcare provider. Calling 811 it can connect you with services and supports that help to quit smoking or vaping. Tobacco Free Nova Scotia's website at tobaccofree.novascotia.ca also has a lot of resources there. It's important that people understand this, and if they are in a place where they're ready to consider quitting smoking or vaping or even reducing their use of those products, that they reach out for help. Now is the time to do it if you're in that position. Premier.
Thank you, Dr. Strang, and now we'll be happy to answer any questions. Chrissy?
Reporters will get one question and one follow-up in the amount of time that we have for today. First question will go to Keith Doucette with the Canadian Press.
Good afternoon. Dr. Strang, I'm just wondering what kind of a trend you would be looking for in terms of opening up the province's restrictions, as opposed to you started off by warning that 2 days basically did not make a trend. How close are we, and what kind of conditions will you look for before you present the province's plan?
So we'd like to see a trend from a pure public health perspective. We'd like to see a trend of little to no cases and have that sustained for a minimum of 2 weeks. Ideally, it would be 28 days. That simply it is that 2 weeks or 14 days is one incubation period for COVID-19, and ideally, from a public health perspective, we have 2 incubation periods. There are other issues to consider in that, but certainly I would say we need to have a minimum of 2 weeks of sustained little to no new cases on an ongoing basis before we can reach the conclusion that we're now at a place that we have very low levels of COVID-19 transmission, and we can start to move into the recovery strategy.
Keith, do you have a follow-up?
Yes, it's regards to Northwood. The numbers are still relatively, or not relatively, they are high there. Is there any light at the end of the tunnel in terms of trends you're seeing in terms of the outbreak there that you can report to us?
Well, we're still, you're right, we are having, I mean, the good news is that we have gone through, completed the testing of all the residents, and for the last few days, we're still continuing to test some residents or if they're negative, we have a strategy to continue to test those who may have been previously exposed to COVID-19. The fact that we're seeing a significant reduction in the number of positive residents in the last few days is encouraging. We continue to also test staff, and we have had some staff newly test positive. We have examined that in detail, and our examination of those cases gives us the reassurance that we have the appropriate infection control steps in measures in place. It's an indication when you have healthcare workers carrying on an ongoing intensive basis with people with COVID-19, how easy that virus can be to transmit. But it is going to take some time before the outbreak can be considered to be winding down. It's just a fact of the large numbers of people in that facility that have been infected, and we continue to have significant numbers who are requiring substantive support for their health needs.
Next question will go to CTV's Natasha Pace.
Thank you. Dr. Strang, I'm wondering if you could talk about, I know we don't have an official plan yet to reopen Nova Scotia's economy, but in the first phase of the projected reopening, you did mention that restarting non-urgent health care services is in that phase. What does that mean? What is a non-urgent health care service? What can we expect would be restarted?
So we know that in our hospitals, in preparation for COVID-19, that we stopped a lot of services, whether they're outpatient clinics, a lot of surgeries were stopped. We still continued with emergency events, emergency surgeries. Cancer treatment was continued, and a necessary diagnosis. But many of the outpatient clinics, many of the less urgent surgeries were stopped. We're now actively looking to restarting those. But we also had shifted much of our care in primary care to virtual care. We didn't stop that. We're looking to continue that. It's one of the gains that we've made through the COVID-19 response that we want to sustain is a greater capacity for virtual care and primary care. Many of our regulated health professions, whether they were dentists or physiotherapists, they were limited to providing only emergency care unless they could, in terms of face-to-face care, and the only other care they could provide was virtual care. And for many groups, like physiotherapists as an example, virtually all of their care by necessity has to be done in face-to-face. So we're looking at, as part of our consultations into the recovery strategy, engaging all those regulated health professions. I have a meeting coming up in the next few days to start to support them, how they develop their plans to safely return to practice. One of our priorities is dental care, and I have a meeting coming up with Friday to meet with the dental community about how they can slowly start to expand their services in a safe manner.
Natasha, do you have a follow-up?
I do, yes. I'm wondering, the situation at Northwood, does that have to be, I don't know if under control is the right word, but do we have to wait until there's a period of no cases there for 28 days before we start to unveil that reopening plan?
No, we're looking at Northwood separately. When we look at our epidemiology, we look at our community-based epidemiology, and then we have Northwood separately. As long as there's no indications of workers who may be exposed and newly test positive in Northwood, about them then transmitting it back into community. So we have to be aware of that. But we're looking at we continue to look at our community-based cases as the key indicator to informing the timing of our recovery plan.
Next question will go to Alicia Draus with Global.
Thanks. I'm just wondering, New Brunswick and PEI are discussing the possibility of becoming bubble provinces and opening up travel between the two. Both, though, have said that Nova Scotia likely wouldn't be included in that arrangement. Just wondering, Premier, what's your response to this, and if you would like to see Nova Scotia included in some kind of regional travel arrangements?
Well, there's been ongoing conversation about the possibility of that, but the reality of it is we're going to continue to focus on ensuring that we flatten the curve here when it comes to COVID-19, continue to work with our partners inside the province, the organizations that represent our economy, whether it's the Restaurant Association, Cosmetology, the Dental Association, continue to make sure that when we open up our economy, people will understand the rules. If you look across the country, there are people who've already begun to open up different phases of their economy, but the people who are affected by that don't know the rules to play by. We wanted to make sure that as we open up the economy, that restaurants know what they have to do on day one, that cosmetologists know what they have to do on day one, that dental offices across this province know what they have to do on day one. And that's what our focus will be. I think what you're referring to, it would be potentially something later into the summer, but we as a province have not locked down our province like our sister two provinces have. We certainly restricted access. We've told Nova Scotians to go home and self-isolate, and we'll continue to move along the path that we're on with the focus on the health and safety of Nova Scotians.
Alicia, do you have a follow-up?
In regards to reopening some of the province, again, most of the cases have been limited to HRM, and other parts of the province are already not seeing much activity. So I'm just wondering if there's consideration to open up other parts of the province before HRM.
Well, it depends on actually what you're referring to. I was having this conversation actually at home this weekend. For example, if you're a dentist whose clientele are in a certain part of the province, I think it behooves us to have a look at that. But if it's shopping or if it's opening up malls, it's nonsensical, goes against the theory, because people will leave and travel from HRM to wherever part of the province where the malls are opening and go shopping. So what you're doing is potentially running the risk of transmitting that virus. But it depends on how localized the activity is. If the activity that we're referring to is localized to a particular community or particular region, then I think it behooves us to look at it. But if it's a province-wide scenario, it just doesn't make sense until we are comfortable, until public health is comfortable, that we've literally flattened the curve and reduced the risk of spreading this virus.
Next question will go to Shayna Locke with CBC.
Hello. My first question is for Dr. Strang. I believe you said to Natasha that you're looking at Northwood separately and looking at community-based indicators. But I understand from the Health Authority that all community clusters in Fairview, Dartmouth North, and the Prestons have been resolved, and that currently there are no community clusters left. So I'm wondering, could you confirm that and tell us what the implications are there?
So, yeah, that's right. We had a definition of number of cases per when we looked at it by by postal code, and above that threshold we said we're community clusters. We've now at a place where the number of cases in even within HRM is low enough that we don't have any that meet that threshold. We're now seeing very sporadic new cases occurring in communities. So there's no, even in HRM, there's no indication of significant ongoing community transmission. all of which is where we want to be in terms of, but we need that trend to continue. We need to be very careful of moving too soon. We want to make sure we have enough time that where ongoing evidence over a number of days, I said a minimum of 2 weeks, that we can come to the conclusion that we have very low levels of COVID activity before we can start the recovery plan. But certainly the lack of community clusters is an indication of that we're getting there.
Shana, do you have a follow-up?
Yes, I do. Thank you. My follow-up is for the Premier. Premier, this morning I heard Dr. Strang tell my colleagues at Information Morning how families with elders in long-term care should consider the possibility they won't get to see their loved ones in person again. And I understand it was very hard for him to have to say that. So my question for you is, I'm wondering, how do we build long-term care differently? For example, the province is still at the design phase for the long-term care facilities in North Sydney and New Waterford. So what direction are you going to give to make sure our experience with COVID influences the design of those facilities?
What Dr. Strang told your colleagues was that it would be longer for the restrictions to come off of long-term care facilities. So we may be a little bit longer before we get to see our loved ones, whether that is late in December. It's not that we would never see them again. That was not the intent of the comment, but because I actually listened to the conversation, and it was about, it would be one of the last things that we'd lift the restrictions on. And obviously, people know why. It's a vulnerable population. We need to make sure that we have COVID under control. If you go look at some of the new builds across our province, they've identified and been working with how do we best build a facility that allows the appropriate number of residents to be there so that you can staff it, provide them with the professional care that they need. Many of them move to pods, so you have wings, 3 or 4 wings that actually make a facility now. In the center, there's a center pod that can be used as a common area. Each of those wings usually have its own kitchen. So inside of those facilities, you can isolate communities is what they are. They're homes. And much of that is done for the fact that when our loved ones go into these facilities, they are moving into their new home. They're not moving into an institution to be cared for. They're moving into a new home, and the atmosphere is being built around that, wider hallways. And the number is what we think reflects the ability to be able to build those facilities. So public health has been working for decades on this. I know that, as all of us know, Northwood is the largest facility east of Montreal. I've been so grateful for the families who've talked and expressed the care that their loved one had been receiving from Northwood, how much they appreciated the work that staff was doing and the executive director was doing to provide them care in a loving environment. But as this is all over, when we see across the country, we'll do an assessment on large facilities like that. What is the right number, if we should have any common rooms? Those kinds of things are ongoing. But the ones that are being built currently are on the new model. That data is out there from public health, not public health, sorry, but from continuing care.
Next question will go to Lindsay Armstrong with All Nova Scotia.
Thank you. In the province's essential care top-up program, will staff working with vulnerable people at private retirement homes like the Berkeley or Shanx be eligible?
Those that are being supported through our portion that's being covered by the province that we subsidize, all of those would be, so are private partners. So the Shanx facilities that care for Nova Scotians that are supported through public per diem would be part of that. Their private facilities that are associated with those would not.
Lindsay, do you have a follow-up?
Yes. So will this program be administered by Dalhousie like the other programs, or will it directly be administered through the federal government?
No, it'll go directly to our partners. So, for example, in our own health, those actively involved in the healthcare system and the public system would go through in combination with the federal government and provincial government. At the same time, then our partners out delivering long-term care, we would work with them on how best to distribute that to their employees, because we would require them to give us a list of who that is, and for privacy reasons, it may be that we would just provide them the funding and they would then distribute it to their employees.
Next question will go to Stuart Peddle with the Chronicle Herald.
Hello, I have a question about the restrictions being lifted. We have already seen some restrictions being lifted as far as outdoor activities like hiking trails, like fishing, like things like that. So I was wondering if there's anything else imminent that could be not considered opening economically, because you've mentioned that you need a good long time of no cases. But what measures could be somewhat relaxed in the very near future that Nova Scotians could be looking forward to?
So we're actively looking at some other steps that may allow additional opening up into outdoor spaces, while still following rules around social distancing, etc. So you'll hear more about that in the next few days ahead.
Stuart, do you have a follow-up?
Not really, no. Thank you.
Next question is going to go to Katie Hartai with News 95.7.
Dr. Strang, we're now seeing increasingly more negative tests coming back. Are you concerned about how many of those could be false negatives and just the overall accuracy of current testing?
So we know that when we base testing on people that are symptomatic, which is the foundation of our testing, the test is highly accurate. That when you start to get into asymptomatic people, then you have more of a risk of having a false negative test, and that's why, so for instance, when we use that test, when we test close contacts and they're negative, we certainly make sure that they're aware of the need for, if they become symptomatic, that they need to come in and be tested again. But again, it's using that test broadly in the public for everybody who's asymptomatic has a lot of limitations. The way we're using it, continue to hear from our laboratory colleagues that we get very valid results from that test.
Katie, do you have a follow-up?
Yes, please. Premier, some operations that are environmentally invasive have reclamation bonds to ensure that they're responsible for the cleanup of their site and not government. Now, with Northern Pulp, we learned today that Nova Scotian taxpayers are contributing up to $10 million towards its remediation. Does this mean that Northern Pulp doesn't have a reclamation bond? And if not, do you think it's fair that Nova Scotians are paying for Northern Pulp's cleanup?
So actually, if you go back to when Northern Pulp was closed, we actually as a province are liable for the pipe that comes from Northern Pulp. We were liable, or portion thereof, of some of the ponds around Boat Harbour that had aeration in them that had to be cleaned out. We will also be looking at the leachate to ensuring that gets off that property. I felt I had a responsibility to all Nova Scotians not to create another environmental issue somewhere else. So we invested to make sure that our pipe, our responsibilities are cleaned up and that there's not another environmental challenge that some future government is going to have to deal with. And we'll continue down that process. And it's important to note, it's up to $10 million. If it costs more than that, more than the $20 million, the government or the company would have to pick up anything over and above. So we're capped at $10 million. So it's dollar for dollar for the first 10, and after that, it's up to the company. But I want to be clear. These were to work when dealing with the issues that I'd made very clear to all Nova Scotians that we had a responsibility to deal with, and then to ensure that there would not be another issue associated with leachate while we're covering those sites. I think it's important that all Nova Scotians have confidence that my commitment to dealing with Boat Harbour is real. I've demonstrated that. I will continue to demonstrate that. But I also said very clearly, I'm not going to move the environmental issues associated with Boat Harbour to some other part of our province or some other site. I'm going to stay committed to that, focused on that, and I look forward to the day that environment is put back to the way it was, and the company can make a decision about what its future is here in our province.
Next question will go to Evan Taylor with CKBW.
My question's for Dr. Strang. We have heard reports that EHS paramedics have been asked to hang on to valve bag masks after they've been used to potentially explore recycling them. I'm wondering if you are aware of that and could tell me more about that.
I'm aware of that. I don't know it in detail. What I do know is from the what EHS explained in a media report that I read yesterday, that there's their supplier has indicated that there might be a shortage of these. So they're asking people, they are disposable, but they're asking to hang on to those right now while they explore options with the supplier, but also explore options of how those could safely be sterilized and reused if necessary.
Evan, do you have a follow-up?
Yes, I have a follow-up for Dr. Strang as well. Earlier you had mentioned about vaping and tobacco smokers being at an increased risk for COVID-19. I was wondering if that extends to people who smoke cannabis as well, or if that information is available yet.
I'm not aware if there have been any studies done directly on cannabis. Certainly our overall position on cannabis is we know that it's better for your health of your lungs, that you don't inhale or vape any product, and that we encourage people to use other forms of consumption of cannabis. I think it makes sense to conclude that if you're smoking anything, that it's quite possible that it increases your risk of a more severe outcome from a respiratory virus like COVID.
Next question will go to Kyle Shaw with the Coast.
Hi. When the federal government wanted people to stay home, it implemented the Canada Emergency Response Benefit. So with the CERB, Ottawa's sending a signal that $2,000 a month is a realistic minimum amount to replace income, and that will not work. But given Nova Scotia's minimum wage, that means for an awful lot of workers in the province, their after-tax income is actually less than the CERB. So for Premier McNeil, what are you doing to close this gap in what a minimum living wage is considered between Nova Scotia's government and the federal government?
Well, the national government also laid out following that a program that works directly with the private sector on wage top-ups to keep people employed. I think the reality of it is what we're looking for, and what we have focused on, is how do we best support businesses and how do we best support some of the national programs to keep businesses active so that they continue to hire our sons and daughters across the province as we go forward. Listen, we have continued to deal with the issue of how do we deal with public health and then begin to open up the economy. The national government has made programs that support the country. It's a one-size-fits-all. Some of them work for Nova Scotia and some of them don't. What we're going to do is focus on the ones that do, try to make sure people know about them, and then how do we best weave our way into supporting those companies to keep them whole so they can be there when the economy opens up and sometime in the not-too-distant future to be able to start employing our sons and daughters.
Kyle, do you have a follow-up?
Yes. For Dr. Strang, on testing, it sounds like the province is doing really well compared to the rest of the country at testing people for active COVID-19 disease. But what is our capacity to test for antibodies in people who've recovered from the disease or who might have had the disease without even realizing it?
So there's still work underway at a national level, led by the National Microbiology Lab in Winnipeg. They're the lead on all of the assessing any of the testing technologies that are coming forward. My understanding is, that the serology test that you're talking about is in the process of being validated. It's not yet ready to be used broadly. Any lab test needs to go through a number of steps to make sure that it will perform with appropriate accuracy when you actually start to use it on the front lines in healthcare. So we're in the process of doing that validation, is my understanding, with a serology test.
And that's all the reporters on the line for today. Go ahead, Premier.
Thank you, Chrissy. This is a significant time for nurses in our province and across the country. It is the year of the nurse, the week, and the day of the nurse. Nurses have always provided expertise and care for patients across our province. And during COVID-19, they played a critical role in helping keep Nova Scotians safe. And I want to express my appreciation to all of the nurses across our province, not only for what you're doing through COVID, but what you've been doing for decades to ensure that our families have the care they deserve, and the respect that you show our loved ones and our families when they're in your care. But in the midst of this pandemic, we have asked our nurses to go above and beyond. They answered the call and they faced the virus head on. They are among our healthcare heroes. And if you know a nurse, Give them a nod, a wave, or a shout out on social media. Let them know we appreciate not only what they're doing during COVID, but what they do all year long to ensure that when we as a family or individual Nova Scotians that are most vulnerable, we find ourselves standing in front of someone who cares and loves us and wants to support us and lessen the anxiety that we feel.